Hi, my name is James Klim. Let's talk about all ceramic dentistry. Many people have concerns about that for several reasons. Number one is maybe they've had some hiccups with their all ceramic dentistry from a lab, or worst of all, maybe you've had a few patients with CEREC restorations come through your practice and you're having to replace them. You know, the mouth is a human environment, but I have replaced restorations such as amalgams, composites, all ceramic dentistry, PFMs, and even gold, because sooner or later the hurricane environment of a mouth can challenge any type of dentistry, because look what it's done to nature. But let me put this in perspective. The ceramics that we use and mill, if you look at the studies in the literature, they have the least probability of inherent flaws within the ceramic. It's been well documented that most failures in ceramics happen around defects and flaws, such as maybe we didn't polish the surface enough after we adjusted the occlusion, or maybe there's an inherent defect within the ceramic which acts as a fulcrum point, kind of like that little pebble that hits your windshield, and then over time you see that crack develop. If we can bypass those problems, we can have very good success. There's a 9-year study out with CEREC restorations that were polished that shows 95% effectiveness. In other words, they're still functioning in the mouth after 9 years. The 18-year study, and it's done under a controlled environment, is up around 90%. So we know it works. It is true, there is a clinical skill set that we need to apply to all ceramic dentistry. However, the game changer is here. It's called Emax. Yeah, I'm sure you've heard of it. Emax is a ceramic that significantly improves the functionality within the mouth. The latest studies done at New York University document the fact that Emax, and that's assuming that we're preparing adequately, that Emax itself will outperform a zirconium-based veneered crown and a PFM. And you're starting to hear that comment among some of our icons in restorative dentistry. So what does that mean to us as CEREC users? We now have the materials to be very comprehensive in our care. Historically, CEREC has been known for inlay and onlay type of restorations. Going to a full crown was a little insecure for a lot of us. Now that we have Emax, I would say the bread and butter of CEREC is now the full crown. For instance, in the study done at New York University, they documented the fact that Emax, under many cyclic fatigue cycles, started to fail at over 1,100 newtons. PFMs are around 700. Zirconium-based veneered crowns are around 350. Now put that into perspective of an average chewer. We're about 50 to 150 newtons of force. Bruxers and clenchers run up around 700 to 900 newtons of force. So if you look at that in perspective of what we can use clinically, we now have a ceramic that can deal with really challenged occlusal profiles. That has changed the game within CEREC, and I just thought you needed to know about that. With the ability to manage Emax full crowns, that is the new bread and butter for CAD/CAM dentistry, and what I use primarily for my full coverage restorations in the posterior component of the mouth.